Hello all, this is Dr. Shilpi Reddy, Clinical Director, KIMS Cuddles Mother and Child Center, Kondapur, Hyderabad. October is Breast Cancer Awareness Month, and we're doing a series of videos to know more about breast cancer. But before knowing about breast cancer, I want everybody to know what are the normal changes that occur in breast in normal stages of life. So, it is important that you know breast changes during your lifetime that are not cancer. So, let's go and take a look at that. Especially when you are before you or doing your menstrual periods, or before or just after your periods, you may have little bit of swollen breasts with little bit of tenderness, little bit of pain, and sometimes you can feel them lumpy. They sometimes you can have that water retention that is visibly seen in your breasts, and your breasts are little heavy. These are supposed to be normal findings just before your periods, or during your periods, or just after your periods. At times during ovulation also, women do feel about these kind of symptoms, and they are pretty much normal, which they do disappear when you don't have these kind of period similarities. And during pregnancy, it is important that you know what kind of changes that happen to your breast during pregnancy. Your breast may feel lumpy because there is a size of the glands that increases, and increasing in the number of glands and getting larger is a symptom and sign of pregnancy. There is pigmentation in your nipple area. The nipples do enlarge in size, and there can be clogs that can happen in your breast ducts that can cause mastitis or breast milk collection in the ducts and in the gland, and that is called as mastitis, especially to women who are breastfeeding. And mastitis can cause the breast to look red and feel lumpy and warm and tender, and it can form an abscess also, and this can be treated with antibiotics. And sometimes the breast, when it is enlarged and there's a pus collection in it, it needs to be drained also. These are certain symptoms and signs during pregnancy which are normal and are quite commonly seen, and these are not cancer. And as you approach menopause, your hormonal levels do change very drastically. This might cause a little bit more of breast tenderness, and when you are not having your regular periods, your breasts may also feel more lumpy as they did not feel before. And these are some of the few changes that usually occur during menopause. And perimenopausal age time also, there is little bit of water retention and tenderness and soreness of breasts. And if you are taking hormones such as HRT, or you are on any kind of a hormonal pills or birth control pills or any injectables, your breast may become some more dense. And even during a mammograph, it is hard to interpret certain changes. And your healthcare provider will definitely know what kind of problem you're dealing with. But it is quite common when you are on hormone replacement therapy for breast tenderness, breast soreness, and little heavier breasts and denser breasts. And after menopause, perimenopausal changes in breast we've discussed, and post menopause, your hormone levels really drop very much, and you may stop feeling those kind of lumps or pain or nipple discharge that you used to have. But you just have to be more watchful. And your breast health is very, very important, and you need to know what are normal changes and what are not normal, and you need to really discuss it with your care provider when you have any significant breast changes, because sometimes changes do mimic normalcy but they are not normal. So if you are recognizing them on a cyclical basis, maybe they are related to your periods. If they are a part and parcel of your pregnancy and delivery, they can be because of the pregnancy per se and lactation itself. And if they are around menopause, you need to be watchful whether it is because of water retention or any other intake of hormonal pills or HRT or all these things. So it is more important to be watchful and to predict any kind of abnormalities at the earliest and watch over, so that you can report it to the medical supervisor as soon as possible and report it to the doctor as soon as possible.